Great, wonderful. Well, welcome to our Tuesday evening conference session. We are very excited to have you here today. Great having you all here. I want to jump right in. We're going to be talking about communicating effectively with Congress in your community. We're going to start off with a great panel of some of our global health and nurse experts, and then we'll hear from Peter Yo and Brian Massa, who are part of our direct lobbying team at UNF, and talk a little bit more about the specifics of our talking points, et cetera. But this whole evening is designed to help you feel more confident and effective when you're talking to your members of Congress. And just know that we're all available to answer questions throughout, afterwards. So without further ado, I will introduce our lovely panel. So first off, we have Katie Lesser, who is the Student Services Assistant for Cornell University's Master of Public Health program. In addition to working within the MPH program, Katie has helped the university at large with COVID response over the last year. So serving as pandemic response officer and contact tracer, Katie has also worked on the New York State Public Health Corps and Citizen Public Health training courses, both initiatives created by former Governor Andrew Cuomo to help New York residents become leaders within their communities. Katie's a graduate of University of South Florida, receiving her Master of Public Health in Epidemiology and Global Communicable Disease, and a graduate certificate in Infection Control. So we're very happy to have her here with us. She's also an advocacy lead for our New York State, for our campaign, Shot at Life, for global health and worldwide access to childhood vaccines. So thank you, Katie, for joining us.
Happy to be here.
Thank you for coming. And then next up, we have Joan Edelstein, is a professor of nursing with a doctorate in public health, who has taught maternal, child, and community health nursing for 40 years. She is currently faculty in the School Nurse Credential Program at Sacramento State University, where she teaches policy and provides expertise on immunizations for school nurses. As a member of Vaccinate California, a grassroots organization that sponsored school immunization legislation and ultimately eliminating the personal belief exemption and cracking down on bogus medical exemptions, she's a resource for school nurses all across the state. She's also an active member of Nurses Who Vaccinate, and supported by UCSF School of Nursing, Joan developed a COVID immunization training for nurses with an emphasis on addressing vaccine hesitancy. And in that 4-hour training and small group practice portion of the 16-hour program, nurses have the opportunity to be both nurse and the vaccine hesitant person during guided role play. So we're excited to have her here. Feedback from over 100 school nurses indicates the usefulness and success of that role play. So we're happy to bring that to you today, and increasing confidence in those working with the vaccine hesitant. So, and then in her spare time, she also addresses misinformation on social media, including Facebook and Nextdoor, plays mahjong, reads, bakes, and watches movies. So welcome, Joan. And then last up, we have Melody Ann Butler, who's our mother of 4 and a registered nurse who works on Long Island in New York as an infection preventionist with previous pediatric nursing experience since 2007. In 2011, she founded Nurses Who Vaccinate, a not-for-profit organization that provides nurses, healthcare professionals, and vaccine advocates with current evidence-based information on immunizations, current recommendations, and benefits of immunizing. Melody's work with Nurses Who Vaccinate has given her opportunities to participate on advisory roles within national public health organizations such as Voices for Vaccines, Every Child by 2, and our very own Shot at Life campaign. So please welcome our panel. We're so excited to have you here. And ladies, I'll let you take it from here.
Thanks so much for inviting us to speak. I'm going to moderate this panel and ask some questions to Melody and Joan to answer. So we'll just get started. So, Melody, as a leader of Nurses Who Vaccinate and a nurse, how are you handling misinformation online, in the workplace, and with family friends?
So that's a great question. And I just want to say thank you so much for Shot at Life for allowing Nurses Who Vaccinate members to participate and to be a partner this year. Very exciting. So much great information at this conference, and I'm looking forward to us bringing it back. Now, with the information we have at hand, what are we doing with it? Well, so you asked, how are we addressing misinformation online? And what we're doing is, as members, we're making sure that we are providing evidence-based research and answering questions of those that we see that are, whether as a comment or a post from families and friends, or going in the newspaper sections and making sure that there's articles being shared, if there's very popular posts being done, that people, if they're legitimately asking questions, that we are there to provide the information that they're seeking. How are we countering misinformation with families and friends? Well, we are making sure that we are remaining professional in all of our conversations, from the easy questions to the tough ones, and letting people know that as nurses, that we are a credible resource. Sorry, I have some tag-alongs as a mother of four, I'm sure. I always put that in my bio because you never know what's going to appear on screen. We're making sure that, when we're educating friends and families, that we're providing all the resources that they need to help make the right medical decisions, and really help them to debunk all these myths and rumors that they're being presented with online. And then the third part you asked, Katie, can you remind me what the third one was?
In the workplace.
In the workplace, yeah. So nurses, we're not, as nurses, we're not immune to falling victim to misinformation. So it's really important that we as nurses, and we help our colleagues in the healthcare field, understand how to interpret good research, help them to understand the criteria of what makes a good study versus one that's not. Helping everyone to stay up to date with the latest recommendations and the guidelines. That's really important, especially as we have seen with this pandemic. Sometimes information can change on a weekly to almost daily basis, but that's not a bad thing. It just means that we as a community, as a society, we're learning more about this particular virus. And to help other people understand that, updating guidelines doesn't mean we were necessarily wrong in the first place. We just have better information to make better practices now.
That's a great. That's really great. Joan, same question. How are you combating all of this misinformation in your circles?
Yeah. So first, I would say ditto to what Melody said. That was a comprehensive response. I would just add a couple of things. One is the piece about staying professional and using evidence-based approaches when we discuss vaccines, both online and with our colleagues in the workplace, with our family. And so we don't do anything differently there than we do than what we're presenting on the panel. We don't blame or shame or just present facts and say you're wrong. And I think that that's an important piece of presenting accurate information online, because it's not just the person you're responding to. It's on social media, for example, everyone else who's reading that thread. And we want to be really clear to appear professional and sympathetic, because there are people who are concerned. So I think that's probably one of the more important pieces that goes into combating misinformation. The other thing I would add that we're doing and have been doing for some time is looking at a policy and systemic level. So we have discussions about, for example, when we have professional colleagues who are providing misinformation, having discussions about how do we deal with this on a systems level? How do we deal with people who are specifically providing misinformation out in public spaces and having followers, so that boards of nursing, for example, or boards of medicine will be able to address those issues?
I agree completely. I think it's incredibly important to use evidence-based resources like you both mentioned. And I know Melody mentioned explaining to people what's a good study and what's not. And I feel like that's a big gap in knowledge between us as professionals and the general public, because they might not have had the training to understand why something is bad science based on the study design. Like, I know in public health specifically, that's one of the things in epidemiology courses that they teach you, is the difference between studies and why something is a good or bad study. So I think that that's interesting that you mentioned that for combating misinformation, because I think that that's an important distinction when talking about like good versus bad science.
No, absolutely. And even, when you're talking to your legislators, sometimes you will be confronted with maybe a study that they've come across. You may not be familiar with it, but it's always important to let people know that you may not have the answers right then and there. And it's so important to facilitate a relationship and a rapport when you're talking to your legislators or fellow members of your family or your colleagues, to let them know that you'll get back to them with this research, because that's what a good researcher does. You don't just throw out information for the sake of throwing out information. You're going to make sure that what you're providing is accurate and it's up to date, and it's something we all need to make sure we're doing a very good job at it, because especially as a Shot at Life champion, whether you're a nurse or not, you are going to be in a position here and you're going to have a title, right? You're a Shot at Life champion. You're part of this organization.
Right.
So we're not representing Shot at Life at these meetings, hosting events, educating people about Shot at Life and what they do across the world. It's so important to remember that it's okay to let people know you don't have the answers, because you're going to know the people who do. And we'll make sure that you guys get the information that you need to answer those tricky questions.
Absolutely. With that, kind of giving those examples of how you would talk to people in your workplace, family, and online, would you be able to show us an example of vaccine hesitant patients and colleagues, and then maybe an example of if you were interacting with legislators and members of Congress who are also vaccine hesitant?
Absolutely. So for this exercise, I'd like to let Joan play the part of the vaccine hesitant family member, friend, colleague, and I'll be the nurse friend who they're asking the questions of.
All right, yeah. So I'm starting out as a colleague, and I'm just going to preface this by saying that Melody and I have not rehearsed. We have not gone through this. This is totally improvised. So, so I'm a colleague, and Melody, I'm sorry. I did get your email about calling our Congress people and stuff about getting the vaccine bill through. But, I have to be honest with you. I have grandchildren. There are too many vaccines given at the same time. And it's really a danger to our children. I don't understand why they're not spaced out. I think they're very important. I'm not saying I'm against vaccines. I certainly am for vaccines, and we're all vaccinated. But it's just too many at one time. So I'm not comfortable.
So I definitely understand your concern. And when we're looking at the schedule, especially now, when we see how many kids are missing vaccine visits because of the pandemic, and that's a really big problem we have right now. A lot of kids are behind on their vaccine schedules. They haven't received their boosters, or some of them haven't even started really important series. So as a fellow nurse, I definitely can understand why someone would be very hesitant when they see how many vaccines there are to offer. I do have some information, though. Would you like to hear about why I still do recommend getting the vaccines as they're scheduled and as they're called for, even if people are behind?
Well, yeah, I would, but I just want to say that it seems to me, and I do want to hear what you have to say, but it does seem to me that if they're already behind and they can be spaced already, then they should just do it a bit at a time, because they've already shown that they can do it that way.
So I can definitely understand why one would feel that way. But there are some advantages about giving the vaccines when they're due at the same time. And I just want to let you know that I have attended a lot of CDC conferences, webinars, and I've asked this very question to the very experts who helped design the schedule. I've been allotted that privilege when by attending all these educational seminars and sessions. So I have had this education.
You were wondering too?
I'm sorry?
You were wondering too?
Well, you know what? I always want to make sure that I'm providing the best recommendations and answers and questions. And, as a mother, I want to make sure I'm making the right decisions for my own children and making sure I'm giving patients and family and friends the best information possible. So I always take these kind of questions to the experts when I need to. And what I have found out is that giving a child several vaccines during the same visit gives you two advantages. One, you're getting them the vaccine as quickly as possible, and they're getting the protection during those early months of their life. So what that means is that we're not leaving them at risk for leaving a window open for them to contract these viruses, this bacteria, the microbes. And especially with all of the children that we're seeing in the communities who are so behind on vaccines, we want to make sure that we're not delaying them anymore. Because at this point, we're not only do we have to worry about the pandemic with COVID, we now have to worry about our communities suffering from outbreaks from measles, pertussis, We have to worry about potential, even polio. We have a lot of visitors coming from outside the country now. We're trying to help our friends and families who live maybe in Afghanistan, right? We're trying to rescue those people who are in harm. There's actually been a couple alerts about that particular population coming to America looking for help because they're behind on vaccines and they're very susceptible. So we want to make sure that we're providing them, those people, the vaccines they need. So they're going to be getting, those refugees will be getting a lot of vaccines at once. And we want to make sure that those surrounding areas and those communities, the children who live in those highly, populations, whether it's like New York or elsewhere, that they're not behind. So we can make sure we're protecting everyone who can potentially come in contact with each other. And then there's another point where giving several vaccines in one visit, one means fewer visits. It saves time, it saves money, and studies have shown it's less traumatic for the child. But I do know that sometimes people are worried about the immune system being overwhelmed.
That's what I'm worried about.
So we have plenty of scientific data that has shown that getting several vaccines at once does not cause any chronic health problems. And we've been able to test this in various studies, not just here in America, but across the world. So we have robust information that this is the safest way to go about this. And we do know that not only does the CDC recommend this, but the American Academy of Pediatrics also recommend getting all the routine childhood vaccines on time and according to whatever schedule you're using, whether it's the catch-up schedule or the regular schedule. And it's so important. I mean, while children will have maybe a little irritable after they get a vaccine, maybe they have a low-grade fever, that's nowhere in comparison. It does not compare to anything they would experience if they were to contract the actual virus or disease. So we want to make sure we're not leaving them open. I would be more worried about delaying a vaccine, and even by that 2 or 3 weeks, we can't afford that right now. Now is the time to get everyone up to date with their vaccines, because leaving them unvaccinated leaves them unprotected, and that's more of a worry than perhaps maybe an increased risk of a fever.
Well, the things you say make sense. They just don't seem to be coming to. Would you do me a favor? I kind of trust you as far as knowing you're good about research and knowing what's good. Could you just send me maybe a couple of well done studies, or
Absolutely,
to say what about it and why, so I can look at them?
And I was going to volunteer that before we ended our conversation, because I want to make sure that you feel as comfortable and confident as I do making this recommendation, so that you as a nurse, if you get asked this information, you can also give a very robust recommendation as well. I want you to feel comfortable with the knowledge. And that's my end game. So I will give you whatever studies you need. There's a lot of great talking points and explanations on resources such as Children's Hospital of Philadelphia. They have a great website called the Vaccination Education Center.
Oh, yeah, isn't Dr. Offit there?
Correct. So we got Dr. Paul Offit over there,
okay,
who's a lead expert over there. And there's been a lot of CDC alerts and guidelines and guidance that's been released about the potential risk for all these communities from the under-vaccinated populations. So I could definitely leave that with you. So
yeah, that would be great, because right now I'm honestly not comfortable talking to families because I just have so many questions, and maybe we could talk after I look at the studies, and because I really could use some support.
Great, absolutely, yes. So thank you, Joan, thank you for coming to me with those questions. I really
thank you for listening. I mean, thank you.
So, all right, so end scene, right? So that's just a quick demonstration, and it's so important that to remember that this is going to be an ongoing dialogue. I never expect anyone to be like, oh, Melody, you're 110%. I'm going to go and do everything you just recommended today. Maybe once in a while that happens, but not all the time, right? So it's important that we create this relationship, that we have this ongoing trust, right? So, and if I didn't know the answer to something, I would let Joan know that. And that's happened to me, even as I'm a certified infection preventionist, right? I've worked pediatrics for years. I still am going to go and check with the experts and the lead resources to make sure I'm up to date with whatever I am talking about. And I believe we're going to go into another example, Joan, right? We're going to do.
So we need to allow the panel to the rest of this conversation to keep going. We'll have to start taking questions in a few minutes. But I just wanted to reiterate, based on the points that both of you have made and the examples made in the little role play exercise, is that, like Melody said, building a rapport among the people you're talking to. This is especially important when you're talking with congressional offices. And if you're not certain about a question, like both Joan and Melody emphasized earlier, don't answer it and let them know, like, we can get back to you on this. If you're not sure about something, don't fib your way through it, because you might not know what you're talking about and it could lead to some misinformation. And we want to avoid that as much as possible. So if you do have questions about specific things, especially related to Shot at Life's asks and the diseases surrounding it, you can always reach out to the champions@shotatlife.org email account, and you'd be able to get more information that way. So you can always reach out to Shot at Life. You can reach out to me, or I'm pretty sure any of us, if you have questions about things related to this topic and misinformation. So with that, we'd like to open it up to some questions from the chat, if anyone has questions for Melody and Joan to answer.
Yeah, and while we're looking, I would just add that what I particularly like about the not having information is that it helps me to prolong the relationship, because, as Melody said, we want to keep that relationship going. I don't want to just answer questions and not be available. I want to keep talking, because it does take a long time.
So I do want to mention that part of my framework of conversation, I use a method called CASE. And for those who are interested, I can always go into more depth on the side after this webinar, this conference. It's something that I really do encourage among our Nurses Who Vaccinate members to use, whether they're talking to people online, whether it's in person with patients in the community. Basically, really quickly, what it is, it's CASE. C stands for corroborate, where in the beginning of our conversation, I acknowledged Joan's concerns. And I let her know that maybe at one point I had the same question, or I had looked this up previously for other patients. A was about me. I wanted to let Joan know what I have done to make myself a credible source of information. So I attended the conferences, I went to sessions. And then C is S is when I brought in the science. And that's when I provided the resources and what we were talking about. And then E is my final explanation and recommendation, where I said, listen, this is what we need to do to get these kids up to speed. Here's, whether they're due for 1 shot or 3, make sure they get it when they need it. So that's the CASE method. And I would love to go more in detail with that. Anyone who has further questions after this conference, or you can check us out and contact me afterwards as well.
Well, if there are no questions from anyone, I'd like to pass it back to Rebecca so that she can introduce the next part of the session. But I'd like to thank Melody and Joan for their expertise on this. It's great being on this panel with you, and I'm so glad that we got to share our expertise on hesitancy with people. I think it's going to be valuable for those who run into these situations going forward.
Great. Thank you for having us.
Yes, thank you all so much. We really appreciate hearing from you, and I'm sure we'll have champions that'll have more questions afterwards. And so everyone else knows Katie, Joan, Melody are fantastic. They've already made it clear that if any of you reach out to anything or to them for anything, we'll make sure to connect you. You can also be sure to check on them in the within the Hopin platform. And actually, it looks like there's one question that came into the Q&A part from Mary Beth Williams. If you all don't mind, just one more minute. What are the studies that you reference, and what are the best sources of info? And of course, we have some at Shot at Life that we can share, but I'd love to hear from you all if you'd like to answer that before you go off camera.
Wants to go first real quick.
Yeah.
So my go-to for, I guess right now with COVID questions, I am going to either Department of Health websites. I'm going to the CDC websites, and I have been, a lot of universities such as Harvard and Yale. They have some great resources for people to use. Also, there is American Nursing Association has COVID vaccine facts for nurses. So as a project that we've been working with ANA to kind of create a one-stop shop for people to get information that they need. And also there's other websites such as nurse-led nurse-led COVID vaccine information. So I can also provide those resources in the chat as well.
Yes. And there are a couple of other questions coming up. Do we have an opportunity to answer those?
I think we're going to move on, just to keep in time, but we'll make sure to connect everyone. And if you all don't mind, they are part of the platform. So the audience, you're welcome. If you find their name in the people section of the Hopin, you'll see where it says chat, polls, people. You can actually find everyone individually, and you can feel free to send them a message. You can also feel free to reach out to our team as well, and we're happy to connect you or get you answers from them and make sure we're all moving forward. Throughout Mobilize to Immunize, we're going to have a lot of conversations between all of us. So please feel free to send any questions that you think of later our way, or message our lovely panel on their own. So thank you again to our panel. We appreciate your time, and I will start to transition over, so you can feel free to, if you want to hop off camera, you don't have to be forced to stay on camera for my next intro. And thanks again. So I'm going to introduce someone from our UNF family, Peter Yo, which many of you are familiar with from our past conferences. But as the president of the Better World Campaign, Peter leads the campaign's strategic engagement with Congress and the administration to promote a strong US-UN relationship. Under his leadership, the Better World Campaign has helped ensure multi-billion-dollar payments from the US government to the UN. And Peter also serves as the senior vice president at the UN Foundation with us. So I'm going to bring him on now, and you'll get to hear a few moments from him. Peter?
Hey, thanks, Rebecca. I really appreciate it. Really enjoyed the previous panel as well. It's just nice to see so many Shot at Life champions with so much to add and so much to advise each other on how to effectively have conversations with our friends and neighbors about these important subjects. So I'm really glad to see that panel. Brian will get on in a second to talk more specifically about the funding streams and funding issues that our Congress is dealing with at the moment related to global vaccines, whether it's polio or measles or COVID. I'm today going to talk more about the broader situation on Capitol Hill and with the White House, about some important streams of work that came out of commitments made by Joe Biden in the context of the presidential campaign. It's not that you're going to be asked about these streams of work and Build Back Better, but rather it's important to know what's on the mind of the congressional staff and the members of Congress with whom you'll be speaking, because these are the things that are really dominating and sucking up a lot of the air on Capitol Hill these days. So the first major stream that Congress is really focused on is this physical infrastructure bill. This is really a groundbreaking piece of legislation that will fund the construction of roads, the improvement of bridges, filling the potholes, working on additional improvements to rail, as well as energy efficiency and other types of initiatives that will have a positive impact in terms of reducing greenhouse gas emissions. So this bill, this physical infrastructure bill, has already passed the Senate. It's been pending over in the House. And for the last 2 weeks, you saw Democrats in the House really trying to assemble a coalition of members to get this bill passed. And they couldn't do it, largely because of the second major initiative, which is the human capital elements of the Build Back Better proposal, which are things like paid maternal leave or paid parental leave, improvements to elder care and child care, free community college, all of which are vitally important to creating an environment in the United States that is more conducive to people getting back to work and families being able to care for their children and their senior citizens. And so these two packages were always intended to go together. When the physical infrastructure package landed over in the House first, the more progressive caucus, as well as the president, said, listen, all fine and dandy, we're not taking that up until the Senate passes the second package, which is the human infrastructure package. And they haven't done that yet, in large part because there are negotiations happening with Senator Manchin from West Virginia, Senator Sinema from Arizona, to get to the 50 votes necessary to pass that human infrastructure package. And so basically what the White House and House Democrats want is the Senate to pass that human infrastructure bill, and then they'll pass both bills at the same time. And seems simple, and yet they've been negotiating for weeks on end to try to get to that. The key issue is on the Senate side, Senators Manchin and Sinema are insisting on bringing down the price tag on that second package from 3.5 trillion to somewhere around 1.5 to 2 trillion. There has been significant progress over the past 72 hours on this front, but there's still no deal. Which brings in the third element that the Hill is dealing with, which is raising the debt ceiling. And Congress has to do this every year and a half or 2 years. And it basically, it raises the amount that the US can borrow to pay for things, for money the government has already spent. It's a technical thing, but it does need to happen. And so that's really what Congress is focused on right now, is figuring out a strategy for raising the debt ceiling. The Republicans have indicated that they will not vote to raise the debt ceiling. So Democrats are trying to figure out a legislative way to do this only with Democratic votes. So debt ceiling, physical infrastructure bill, human infrastructure bill, all happening in real time. It's high politics like I've never seen it. And I've been in Washington since 1985. But it's exciting to watch. I still believe that the Build Back Better agenda, physical and human infrastructure bill, will get done, but it's going to get done perhaps closer to Christmas than now, as is often the case in Washington. And the debt ceiling will be increased probably at the very last moment. So welcome to Washington. So anyways, that's what's on the minds of members of Congress. Doesn't mean that they don't care about global vaccines. They do. It's more a function of the fact that that this is what the members and the staff are talking about most, which is making this, Mobilize to Immunize so even more important, right? Because we've got to make sure that our issue doesn't fall off the agenda. And so phone calls and meetings with members of Congress and staff can ensure that while they're focused on the broader picture, they're not forgetting the importance of immunizing kids around the world against life-threatening diseases. So in any event, great time to be in Washington, great time to be talking to members of Congress and their teams. And Rebecca, I'll send it back to you.
Thank you. And we have time, if you have time for just maybe a question or two. I know we if you don't mind, in our audience, if you would like to take advantage of our time with Peter, we have a couple minutes if you'd like to ask a question or two. So I don't know if you see I don't know if you can see the chat, but we have a question. Okay, I was from Shannon. I know things are crazy, but any bets or predictions on what happens from here? And then Nancy is also asking, will vaccines be well supported?
Yeah, I think that vaccines are going to be well supported in the appropriations process. Brian will tell you more about that. But there's a lot of pressures on the Foreign Affairs account this year, and with a lot of competing demands. And so we need to make sure that vaccines don't fall off the priority list. So that's where you all come in to make sure that that doesn't happen. So yes, there's strong support on the Hill for vaccines, largely because Shot at Life has been, and you all have been at this for year after year after year, and will continue to be, but it's a never-ending task. And so this timing is perfect. Rebecca, remind me of the first question again, sorry.
Basically, Shannon said, I know things are crazy, but any bets or predictions on what happens from here?
Yeah, I mean, there is a slight chance that over the next 2 weeks, as we approach the October 18th deadline set by the Treasury Secretary to raise the debt limit, that there could be a grand bargain that would provide for that human infrastructure package that's part of Build Back Better, roughly around 1.75 trillion, I guess, that would free up that package plus the physical infrastructure package. I would say there's a possibility it could get done before that October 18th deadline. But the president did say that he's now looking towards Christmas as sort of that moment to get this done. So the Democrats have tried to reset the clock on this, as opposed to it's got to happen now, to maybe this could happen in a few weeks.
Great. And our last question is from Diane from Tennessee. Are our senators and reps meeting with constituents in person in DC at all?
Sort of, but not much. The security posture in the Capitol has largely remained the same, and meaning that all constituents have to be met at one of the congressional doors by a staffer and escorted to the meeting and then escorted out of the building. So that really raises the barrier for in-person meetings. And even if they're scheduled, often they'll get postponed or moved to Zoom because it's sort of a pain. So we're not quite there yet in terms of large-scale in-person Hill meetings. They do happen, but not at the scale that they used to. And each office has different policies. We find that members of Congress and staff are still very much interacting via online platforms and taking those meetings, taking phone calls. So this remains the easiest and the most correct way to communicate with our policymakers. Thanks, Diane, for the question.
Great, Peter. That also kind of answers Nancy asked, with all the overtime and stress on the Hill, with the debt ceiling and the infrastructure, will the staff be available to listen to us?
I think they will. I mean, it's still their job. And in a weird way, the pandemic has freed up their time a little bit because there's less running around to meeting after meeting and more sitting at your desk, hopping from Zoom to Zoom. And it's amazing what they can do in terms of freeing up your schedule. So, yeah, they're still doing meetings. I mean, I'd be lying if I'd say there isn't Zoom fatigue. I mean, we're all facing Zoom fatigue. But it is still the proper way to communicate with your members of Congress and staff. You might get district meetings that will be different. Some district offices are more open and flexible because they're not in the campus of the Capitol. So if you get a district meeting, take it, because some district offices have much more flexible policies on security and meetings.
Perfect. Well, thank you so much for spending time with us and going through that big picture view with our champions. We appreciate your time. So thanks again to Peter for joining us.
Thanks, Rebecca.
Thank you. And we're going to transition over to Brian. Many of you know Brian Massa from our team. He joined the United Nations Foundation in 2015 and serves as Director of Global Health Advocacy, where he oversees government relations strategy for the Shot at Life campaign. He also leads UNF's U.S. government advocacy strategy related to the global health security agenda. And prior to joining the foundation, Brian served for 5 years in the Health Policy Office of the Senate Committee on Health, Education, Labor, and Pensions, HELP, chaired by Senator Tom Harkins. So many of you know him from helping you either set up your meetings, helping you on Hill Day, guiding you in your talking points. He's the best resource for our campaign if you have any questions in your outreach. So I will turn it over to you now, Brian.
Thank you, Rebecca, and thank you all for joining. I'm always just so humbled and blown away by the level of excitement and energy turning up on a weekday and in the afternoon or evening, depending on where you're calling in from. So these are the things that really get us up in the morning as Shot at Life staff here. Your commitment to getting federal funding over the finish line for child immunization. So thank you. So I know that there's a mixture here who have a lot of experience doing advocacy, a lot of experience doing advocacy for Shot at Life, and there's some new people here too. So I always like to start my sessions about appropriations and where the federal budget lines fall with just a kind of top line overview of what the congressional appropriations cycle looks like. my goal here is, if at the end of the day you are more comfortable with the context in Congress in which you're making these asks, I feel like that's one of the most powerful ways you can make your message heard. Many people can read off a script, or many people can advocate for an issue, but if you really know how to embed that issue within the current situation in Congress, it's going to be received much more receptively. And I think Peter did an amazing job of telling you that macro level, grand politics, massive infrastructure, $3 trillion bills that are going happening in Congress right now, and which is sucking up a lot of the time. But at the same time, there's a lot of other appropriations, just regular appropriations order for the fiscal year 22. This is what we're talking about right now. All of those appropriations processes are happening in the background, which may not rise to the level of a newspaper headline every day, but is something that is happening there. And that is where we plug into. That is why we advocate. That is how we advocate for the polio, the measles, the Gavi lines, the UNICEF, the WHO. That's where these come in. So without further ado, I'll start with just a quick overview of sort of how the appropriation cycle unfolds, and then get into a little bit more details about how we ended up where we are today with this. So typically, the way that an appropriations year unfolds is at the beginning of the calendar year in January, sometimes February. The president will release what is known as the president's budget. It's basically a laundry list of all of the administration's objectives, priorities, activities, and funding levels attached to them. And that's not just for foreign affairs. That's the entire federal budget. So domestic, international, energy, roads, healthcare, all of that stuff is contained in this president's budget. That sort of sets the tone for the year. And the president will, send this budget over to Congress. And of course, he would really just love for Congress to rubber stamp that budget and send it on its way. Congress, of course, has many other ideas as the constitutional holder of the purse strings. They do like to exert that authority. So while that starts the year off, but that is by no means a rubber stamped budget, which if he has a really positive number for polio in there, for instance, it doesn't necessarily mean that Congress is going to approve that. So we keep a very close eye on the president's budget. Part of my job right now is actually trying to influence the president's budget through his various offices that construct it between roughly August to December is when they're sort of writing the president's budget for the next year, the fiscal year 23, which is what we'll be advocating for next year. So my job is to sort of influence that now, and then hope that those numbers are solid coming out in the January, February period. So the president introduces his budget. He sends it over to Congress. Typically, it falls with a pretty big thud in the halls of Congress because, like I said, Congress likes to exert their own authority on this. And they do that. The next step in the process is the budget committees will get together and sort of negotiate the top line pot of money that they're going to then divide up amongst their 12 subcommittees. And there's a lot of wrangling going back and forth there, but they determine what are known as their top line numbers. And from there, each of the subcommittees is then given a pot of money to start hashing out. And that pot of money, that level kind of changes from year to year, but they all have to work under those constraints once they have that top line number. So the two subcommittees that we typically focus our energies on here at Shot at Life are the Senate Foreign Operations Subcommittee for Appropriations. We call that the SFOPS subcommittee. It's kind of a funny word to say. And then there's another subcommittee that is called the Labor, Health and Human Services and Education Subcommittee, and that's called Labor HHS. So I will try not to use acronyms too much. I know that people's eyes glaze over, including mine, when you use them too often. But if I do slip in an SFOPS or Labor HHS, that's what I'll be referring to. SFOPS, sorry, I've already done it once now. So the Senate Foreign Operations Subcommittee bill is where the polio, part of the polio activities run through USAID. Part of the UNICEF line that we advocate for goes through that subcommittee. WHO, the World Health Organization, also runs through there, and Gavi, the Vaccine Alliance. Then on the Labor HHS side, that's typically a subcommittee that actually deals 99.9% of the work and programs and funding that they do is actually domestically focused. That was actually part of the jurisdiction that my old boss, Tom Harkin, had. I worked on the authorizing side at the Health, Education, Labor, and Pensions Committee, but he was also actually chairman of the Subcommittee for Appropriations, which then appropriated those dollars for those same same issues. So on that side of the equation, that is where Shot at Life's polio eradication line runs through CDC, through the Center for Disease Control, and as well as the measles elimination work. And both of those, the polio and the measles line, run through the Global Immunization Division. So that's just to give you a little context about some of the funding streams there. You'll see on a couple of the talking points that I've given you guys, the leave behind there breaks down each of those budget lines. So you're actually going to be able to see historically over the past, I put about 2 or 3, I think about 3 fiscal years in there, you can see how these lines have progressed. And that's another additional kind of context that's helpful when you talk to staffers, because often a question you'll hear is, well, first of all, what did the president's budget call for? And second of all, what were the previous fiscal years and where were those funded at? We are in a little bit of a strange situation, though, because a lot of this precedent of where were things in the past to dictate where they are in the future doesn't necessarily apply anymore. And that reason is COVID-19. The way that this has transformed global health activities and programs writ large, not just the child immunization, but global health programs, it really can't be overstated. The devastation of the pandemic across the board, and the way that these programs, and I'll get into this a little later, but the way that these programs, global health programs, have been pivoted in a way, and justifiably so, to address the COVID-19 pandemic has really changed the dynamic in Congress. That said, it's our job now to make sure that that funding comes through, because the polio program, for instance, has shifted a lot of assets to the COVID response. We need to make sure that that's actually getting funded to do the polio eradication side of things. So the budget committees have divided up their money. The subcommittees have their top line numbers. And then basically from April until typically August, that's when the actual nuts and bolts of the appropriations process begins. And that's why we time a lot of our activities through the grassroots activations to start in April. We have a big activation right after our summit in February. It runs about 5 weeks, and it's called Advocate to Vaccinate. And that's a really important time, that April-ish time period, to be calling and talking to your representatives and senators, because they're writing those bills right now. Or if they're not on the appropriations committees, they're communicating with those appropriators and weighing in with their priorities. So if you can influence that conversation, that's really important. And that's the time to do it too, that April, May, June, on the House side, and then that kind of July, August period on the Senate side, because the Senate typically takes a little bit more deliberative process on their bills. So August is sort of now in this cycle where things start to get a little bit strange, because for as long as I can remember, Congress has not actually done their job of appropriating and signing off and passing an actual fiscal year budget on time. So you probably have seen a couple of headlines maybe a few weeks ago about a government shutdown as it gets to be close to September, the end of September. That's the end of the fiscal year. And if Congress hasn't appropriated those or passed those appropriation bills and signed off on it with the president's signature, that's what causes the government shutdown. So they do have a safety valve if they're approaching that date and they still haven't done their job sort of, and done it on time, I should say. And that's what's called a continuing resolution. So that basically just tells people that, tells the government that we're going to fund all the different programs at whatever they were funded for the previous fiscal year. And that's a temporary measure. So this current continuing resolution that we're actually under right now, because we've already lapsed on the fiscal year, it's the beginning of October, that's going to run until December 3rd. And they can pick whatever date they wanted. This time they chose December 3rd. So that buys Congress a little bit more time. What that means, though, is that it's not the end of it either. I mean, they still need to actually get back and pass these bills. And the House has already done that. So when you guys go into your meetings and you're talking to the House members, you'll see in the talking points, there's a slight variation in the talking point ask, because you're not actually going to be asking the House members to appropriate money at this point, because they've already done that. And I've included in those talking points what's called the fiscal year 22 House mark. And it's just a short way to say the markup of a bill, which is a hearing they hold for those subcommittee bills where they finalize it and pass it. The House has done that already, so they've done their job. So when you talk to the House side, you can say thank you for providing robust funding measures. And again, you can see what they actually included for each of those budget lines. And you can also, there's another request to tweet some Polio Day support, and that's all contained in those talking points. So it's going to be a little slightly different conversation, though, when you get to the Senate, because right now, actually, the Senate has only released 3 of its 12 subcommittee bills. And I'm just going to say SFOPs and Labor HHS. Those 2 subcommittee bills have not yet been released yet. So they have not shared the details with those, and they're actually not going to mark up those bills. They're going to basically release what they sort of negotiated a little bit behind closed doors on the Senate side. And then what they'll end up doing is going into what's known as a conference. And that's basically from your schoolhouse rock days, your constitutional law days, you basically have to have the same exact form of legislation has to be passed by the House and passed by the Senate. These are very different propositions right now. They're off on numbers, they're off on priorities. And how do you sort those things out? So it's called a conference. And what they'll do is basically both chambers will get together in the Capitol itself, and they'll hash out those differences until they have a bill that matches up. And they can pass both chambers again, because they can match up a bill all they want, but if they don't have the support for it, it's never going to pass, and they'll be back to square one. So that's what's happening on the Senate side. So when you do go there, you can say, we'll flag for you when those subcommittee bills are released, just so you're sort of aware. I think that it's going to be October 18th is when they're going to release those bills. So I guess what I'm saying is, if you have your Senate meeting or you call a Senate office before the 18th, you can just say, I understand that the Senate Appropriations Committee is expected to release those 2 bills, the SFOPs, the Labor HHS bill. We hope that you can weigh in or influence during this conference process. Because when they go behind those closed doors in the Capitol, the 2 of them, they will bring those priorities to them and hash them out. So if you do it after the 18th, you can probably pretty confidently say that I know that the Appropriations Committee has released those 2 bills, and maybe there's a way we can kind of get you that information, what's contained in those bills. It's very top line because of the way that they go about this without an actual hearing where they're going to unpack what's in their bill. They're not going to do that this time, I don't think. So. So there's just kind of some extra context there with the House conversation talking points and then the Senate side conversation talking points. I do feel that, when you go into those meetings and you have that just a little bit of extra inside knowledge, it makes your overall delivery much more credible and receptive. So, I think I might kind of stop there. I know we have 4 minutes or so, but I can go a little bit long. I want to make sure that you guys are comfortable with the situation. If I can provide any more context about what's happening, that will be helpful for you. And then I also want to remind you all that I think we have some office hours on Friday, which I'm going to try to be at. And if you come up with any questions afterward, it's fine to pop in there, and we can have a chat then. So I'll go ahead and stop there and take any questions. I have a hard time believing I've answered all of your questions with 20 minutes of me talking, but well, that's a hard question. Why do you think it's so partisan this year? I do think that over the past 4 years of the Trump administration, it has set new standards for lack of partisanship. And while I think that everybody had high hopes that would sort of be wiped clean with a new administration, and that doesn't, whether it's a new Republican administration or a new Democratic administration, I think people had high hopes that it would, regardless of which party won the office, it would not be as partisan as it was under the Trump administration. And in some ways it has. There's been a sort of thawing in some ways, I think, in the congressional relationships, but that sentiment, that sort of very partisan sentiment, has not gone away entirely. And it's sort of a legacy, I think, that is going to be around for a while, because whether you are a Republican or a Democrat, I think you have found that partisan approach in some circumstances is effective. And I want to be choosing my words carefully here because of the really grave consequences of choosing that. But if you look at effectiveness in terms of electability and re-electability, and in terms of the ability of one person or two people in the entire Congress to hold things up and sort of use their power to leverage things. I think you are seeing people starting to, in some situations, embrace that partisanship, which is not something that I was really accustomed to at this level when I was in the Senate. So the question is, it's going to stay this partisan going forward, I think. And I think that until some kind of structural reforms in Congress are made, that these sort of grand political bills, and also just the appropriations process with them not being able to kind of do their appropriations on time, I think that will probably continue, unfortunately. But things structural, meaning things like filibuster reform, where you can really weaken the ability of one person to stand up and literally grind 534 other members of Congress's work to a halt, because that's the way the Senate rules are structured. So trying to just scroll up here. See if we have any more questions. I think that's all for now. I mean, I don't want to keep you guys too much longer. I don't know if Rebecca's coming back to kind of wrap things up, but again, I'm happy to chat more on Friday during office hours. And just want to say thank you again, because like I said, this is something that really energizes me. I know it energizes the whole team to see you guys showing up and being so committed. And Peter said it very well too. It's an amazingly important time to be doing the work that we do. So Rebecca, back to you.
Thank you. Actually, one quick thing before you go, if you can speak to, this popped in, for the newer folks, Kara put this in there, can you speak to the general, if they've never done this before, the general reception we get on the Hill or in meetings for our asks and our vaccine programs, generally how happy they are to see our champions, essentially.
Yeah, I mean, I think offices, like Peter said, are this is their job to see us no matter what. Does that mean we want to just sort of like be the low bar? No, they are as receptive as we are prepared, I think. The topic of vaccines and global health is incredibly important right now because of COVID-19. So there's a higher level of interest overall than we would typically see, because offices that maybe even weren't prioritizing global health or child immunization, they need to be and are. So there's already a kind of higher level of interest, but there's no kind of general reception for the individual meeting you'll have. It's very dependent on the staffer, and the best way you can prepare for it is by going through the talking points, by hopefully the context that I gave you here is helppful, and I hope you just can use that to really situate yourself during the meetings. So I think these are meetings that they do every single day. This is their bread and butter. I always tell people during these summits or these activations that the first time you talk to somebody, if you've never done this before and talk to a staffer, it's a little bit intimidating. But I guarantee you that by the end of this activation, you will be such a seasoned pro that it'll be like it won't even be a second thought.
Awesome. Thank you so much, Brian. Thanks for taking the time to talk to our champions. And everyone, so this isn't the end of, if you have any questions for Brian that come up later, please feel free to get in touch with us. And as he mentioned, we will have office hours this Friday that we'll send out information for between 12 and 1 Eastern time. You can also recheck out these sessions in the replay area. Anything that's not in that replay area, it's because we have on video. We'll make sure that you get on our YouTube channel. So make sure you can check out either of those. And then just coming up later in the week, we hope to see you tomorrow, Wednesday at noon. We're going to be doing some workshops tomorrow, so it'll be great. At noon Eastern time, we'll be discussing how to get published in your local paper. We'll hear from our comms team. They'll walk you through that and do a workshop. There will also be time to network near the end of that. So if you'd like to meet other champions in your region, it's a great time to do that. Followed by tomorrow evening, we will have a session making the most of your advocacy. We'll have special guest Cynthia Yu, who's the UN Youth Observer. So we're very excited to have her there with us. And then some of our champions will be joining us to talk about, how to really make the most of all the advocacy that we're doing. And we'll break down every single action item that you can take, everything that's on that checklist you've seen from Mobilize to Immunize, we'll go through. And then Thursday, we're going to have a great phone bank at noon Eastern time. We'll walk you through all of that. It's a lot easier than you think if you haven't done it before. So we'll be hands-on to help you do that and hopefully help you plan some phone banks for when you're back with some friends in your community. And then we'll wrap up at 7 p.m. Eastern. We have a great some inspiring wrap-up special guests for that evening. So we hope to see you then. If you have any questions for the team in the meantime, you can always reach out to us at champions@shotatlife.org. But thank you all for joining us today. We appreciate you taking the time out of your busy schedules to be with us. So thanks again, and we will let you have the rest of your evening and hopefully see you all tomorrow at noon Eastern. So thanks again, everyone.